Hi, I'm Dr. Martin Rutherford again, back with our back to basics of functional medicine and what functional medicine should look like and how you go about treating a lot of the chronic cases that we particularly see in this office. We've gone over just a number of things now. I can't put them all in order and review them, but we've gone through the history, we've gone through the exam, we've gone through so many of the basics of what needs to be done, the foundational what needs to be done. And now we're going to start moving into a little bit more into treatment. And this topic today, which is stress, and how chronic stress creates and or perpetuates chronic conditions. It's kind of a borderline foundational issue, and it's kind of also a huge functional issue as far as relative to the future talks are going to be, for example, about the large intestines, the small intestines, the stomach, how they all play into each other, the order in which to attack them. And so when a person comes into our office, we once we've decided that they're probably a good candidate, we have them fill out an 18-page history, and it has questions on all of those areas. And we have one section of about maybe 12 questions on the intestines, and then we have another test area on maybe 5 questions on intestinal permeability. We have 5 pages of questions on the brain and brain chemistry. And brain chemistry, when it goes abnormal, results in anxiety, it results in panic attacks, it results in depression, it results in inflammation. It results in breaking down what's called the blood-brain barrier. The bottom line is all of these different physiological, neurological abnormalities create a lot of problems. I would make the argument that it's at least a ginormous contributor to this expanding group of patients who are the chronic pain patients, the autoimmune patients, and we're going to understand why I think that by the time we're done with this. So basically, yeah, the brain pretty much controls everything, and I'm not going to get into, the neurons and all that type of stuff. But the brain pretty much controls everything. It controls your arms, it controls moving, it controls whether you move your finger, it controls your thinking, it controls all that. We're pretty much aware of all that. And we know that if our arm starts not working and we start getting tremors, we start thinking, oh, there's some nerves that's going on. And sometimes those nerves are coming from the brain, and sometimes they're not. We kind of have a relative grasp of that. But what we see in this office, this I can say with full accuracy, virtually every day, in probably 95% of the new patients that come in here, people who come in here for consultations, people who start care, is that the vast majority of them have a chronic stress response going on. That's separate from the motor nerves that I just got done talking about. Motor nerve is something that allows you to move your hands and move your feet, and then it's separate from the thinking part of your brain. Okay, the thinking part of your brain is all of these ripples, all these rugae in the what's called the cerebrum. Okay, so this is thinking, but we're not talking about those parts of the brain. We're talking about the part of the brain that is the automatic part of the brain, the autonomic part of the brain, which controls your entire physiology without you even thinking about it. The stress response is so important that I don't think that you can get somebody well long term unless you're addressing this response. I don't think you can get a person's irritable bowel syndrome gone long term unless you address the response I'm about to talk about. I don't believe you can get a person's leaky gut better if you don't address this response. And I could go on and on. You're not going to, this goes kind of back to, for those of you who might be familiar with alternative care, this goes back to the days of if you can't fix the adrenals, you can't fix anything, but you can't fix the adrenals if you can't fix the stress response. I've done talks online that were titled, I believe, the adrenals are the wrong target. So in our world, we talked about doing a complete neurological exam on every chronic pain patient that comes in here, and certainly that's warranted if you have fibromyalgia or peripheral neuropathy. Those are nerves. But we do it on somebody comes in here and if they have chronic fatigue or if they have irritable bowel syndrome and they don't have fibromyalgia or some neurological problem like MS or something like that, we still do it for this reason. So let's see. I'm looking for a tool here. Here's my tool. Okay, so there's a part of the brain called the brainstem. And for those of you who are students, you might have heard it called the old brain, the lizard brain. It has a number of different names, but technically it has nothing to do with thinking. It has nothing to do with any of that type of stuff. It does a million things, but what we're particularly interested in this presentation is that fact that it houses something called the autonomic nervous system. You can almost think of it as the automatic nervous system. And what it does is it keeps us balanced, it speeds us up, it slows us down. It controls your saliva, it controls your eyes tearing, it controls your eyes dilating and contracting, it controls everything dilating and contracting, it controls your arteries dilating and contracting, it controls your breathing, it controls your bowel movements. In fact, it controls your sleep. There's a part of it that actually works with a place in your brain called the hippocampus to control your circadian rhythm. You're going to sleep and waking up. Or my patients, I can't go to sleep and I wake up and I can't go back to sleep. And they're now calling this the rest and digest system, because if this system is working properly, you're sleeping well, your bowels are moving well. And so this system is I believe the key to long-term success in the functional world, in any world. I mean, if you're trying to get yourself better and you're having this type of a stress response, you may be someone who goes to a chiropractor and you can't get better and the adjustments hurt you because your muscles are stiff and they never get soft. Or you may go to the physical therapist or the massage therapist, and they say, oh, your muscles are like knots and it hurts when you get taken care of, or just a number of things where this stress response is going to prevent you from even getting well with treatment. So what is this stress response? This is the brainstem, and there's three parts to it. The bottom 2/3, for those of you who are more academic out there, is the pons and the medulla, but the bottom 2/3 basically houses the parasympathetic nervous system. We'll call it the rest and digest relaxation mechanism, okay? And the important thing to understand about this mechanism is that this is kind of where we're supposed to be. The way your brain is set up is it works by stimulation, and we get a lot of sensory input from a lot of things, from walking, from feeling things, from smelling things, and they all feed back to the brain and they stimulate certain parts of the brain. And the brain needs to be stimulated to work right. 95% of stimulation that comes into your brain, okay, and goes up through your thalamus and goes into your brain and all this type of stuff, feeds back to stimulate this part of your brain. Why do I tell you that? Because what I'm trying to show there is that nature knows that we need to be calm all the time, because if this area of the brain is dominating, if it's strong, if it's working, we're going to be calm. We're going to be sleeping well. Our bowels are going to be working well. In absence of some sort of a pathology, this is going to keep us working well. So calm, believe it or not, is your natural state of being. All right. Now, there are neurons. There's a small pool of neurons here in the upper third of your brain, okay? And those neurons are the neurons that run your sympathetic nervous system. And I don't know why they call it sympathetic. I do know why they call it sympathetic, but it sounds like it would be sympathetic to you. But it's not very sympathetic, because it makes you go crazy, because when this goes on, it makes us jittery. Now, this is actually a core survival mechanism for us. So what happens is when this is for those of you who are familiar with the fight-flight mechanism, okay, this is the fight-flight mechanism. This is our innate, primitive survival mechanism. The bear's chasing me, the lion's over there, I either got to throw the spear at it or I got to get out of here, one or the other, okay? So here's how this works. A little bit more of an updated example. Let's say you think like you're going to be walking down the street and you're going to get attacked. Or let's say you simply have to give a speech for the first time and you've never talked in front of 5 people in your whole life. Both of those create a response in what's called your frontal lobe, right here, okay? And this, don't fall apart on me. This is your frontal lobe, okay? And so this is your frontal lobe, this is your thinking, this is who you are, this is your personality, this is where your brain goes, there's a problem here, I need energy. That's what the frontal lobe does. The frontal lobe then sends a signal to these guys. They're called the amygdala. Amygdala are the fear center of your brain. Remember that. It's the fear center of your brain. This center also happens to run your whole emotional system. That's important. That's going to be important to us in a few minutes. So this frontal lobe goes, there's danger. Frontal lobe says we need energy. It tells the amygdala, the fear center of the brain, hey, be fearful because we need energy. And then that tells the little neuron pool here in the upper brain to start making energy right now, the sympathetic nervous system. And here's an important point. This then shuts down the relaxation response. Now again, a more salient even a point than that is you're either here or you're here, but you're never in both. You might be in the fight-flight response and be like a 1 on a scale at 1 to 10, or you might be a 10 on a scale at 1 to 10. But while you're in that flight mechanism, this is pretty much shut down. The relaxation response, where we're supposed to be in our normal state of being, is shut down. When relaxation response is dominating, we are feeling pretty darn good, okay? But we need to get out of here right now because the bear is about to eat us. So this shuts down, and then it sends a signal down here. This is your spinal cord, and it sends it out to something called your adrenal glands, which are 2 little kind of cone-shaped little glands that are sitting on top of your kidneys. And then those adrenal glands start vomiting out hormones. You would know them as stress hormones, although they do a lot of other things. They would vomit out adrenaline. So adrenaline starts making your heart pound, right? And so then they start putting out something called epinephrine. So now you start being able to breathe more. Your bronchial tubes now will start to dilate, and you'll actually be able to take more oxygen in. They put out something called aldosterone. Aldosterone works with your kidneys to raise your blood pressure. Why would you want to raise your blood pressure? Because you got to get blood to your big muscles in your chest, your back, your arms, your butt, your thighs, all the big muscles that are going to allow you to fight or flee. It starts moving blood sugar. There's another hormone that the adrenals put out called corticosteroids. So the corticosteroids then start moving blood sugar out of your liver and into your bloodstream, and a lot more things happen than that. But basically, all of that's happening to put sugar into your muscles, sugar into your frontal lobe, electrolytes. It's moving everything into the big muscles so that they can fight or flee. In the meantime, it's draining blood from your intestines. It's telling your bladder shut down, and whether you realize it or not, it actually even shuts down your throat. Because you don't need to be eating, and you don't need to be peeing, and you don't need to be pooping, right, while you're fighting or fleeing. So nature puts you in the optimum position neurologically and chemically to be able to fight or flee. And this is where that superhuman strength comes from, where you've heard I haven't heard this one lately, but during my lifetime, it's always been the little old gal who weighs about 90 pounds who picks the car up off of the kid that the car just rolled on top of. And these things have happened, and they've been documented. And then when it's over, the person drops the car, and everything goes back to where it should be. And that's what should happen. This should be a very short-term response. What should happen is once the danger is gone, or once the speech is over, or once the kid's out from under the car, what should happen is is this frontal lobe should now say, you know what? Okay, I don't need all that energy anymore because you're gonna be in bad shape if you keep putting all that energy out. And then it tells the fear center to tell something down here called your cerebellum to shut down this midbrain sympathetic fight-flight response, and then you go back to rest and relaxation. Okay, that's not the patient that shows up in here. Okay, the patient that shows up in here is continually in some gradient or level of fight-flight, and so here's how that happens. Okay, so it's the same mechanism, but what happens in the person that has most chronic conditions, again, I'll say 95% of the people that come in here, what happens with them is this fear center gets programmed. So it gets programmed like a computer. It's actually still a survival mechanism. But I just got done saying that it's not a survival mechanism if it goes for more than 5 or 10 or 15 or 20 or 30 minutes or a couple of hours or a couple of days, okay? And it's not. So why does it get programmed, and why is it a survival mechanism? Well, it's a survival mechanism for the reasons that it gets programmed. And the reasons it gets programmed is usually some form of emotional trauma that person's brain perceived as egregious. In the women, it's usually well, I shouldn't say that anymore because I've had men that have gone through this too. Verbal, physical abuse, verbal abuse, sexual abuse. I hate to tell you how frequently that comes in. It could be, that your parents were alcoholics, that they left you. It could be, there's a lot of very specific things. I mean, a lady came in here who was standing there where her husband got shot. These are like abnormal, like out of our reality type of things. And they create such massive fear that the brain will produce something called negative neuroplasticity. So neuroplasticity is when your brain changes to help you more in your endeavors. The simplest way to put that, maybe the simplest example I can think of is playing the piano, okay? So playing the piano. So if you're playing chopsticks, dun, 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 you know the rest, okay? So basically, this part of the brain right here, just I'll put my finger right there, is allowing you to do that, okay? Now let's say you get into something a little bit more complex than those two fingers, okay? Let's say you get into something very simple like, just simple old songs like Sinatra songs or Beatles songs, or even a simple ballad from today, something where the chords are simple. But it's a little more complex. A larger part of the brain will start to help that original area to be able to move the fingers in a more complex fashion. That's called neuroplasticity. The neurons, the brain cells, will actually reach out with these little tentacles called dendrites to other neurons to recruit them to help. By the time you're playing Tchaikovsky, it might be that this whole part of your brain has been recruited to help that. You stop playing for 10 years, it goes back to that. So your brain is plastic. If you ever hear that term, that's what it means. So there's positive neuroplasticity. That's positive neuroplasticity. And there's negative neuroplasticity. And two things I see in this office that are negative neuroplasticity is chronic pain, where the brain has lost its ability to be able to filter out pain, and negative neuroplasticity of this amygdala, which, for starters, creates the situation of the brain not being able to filter out pain if pain is what you have. So this amygdala, this fear center, now gets from one of those other things. Oh, one thing I forgot to mention is what else will prime this is you could be a perfectionist, or you could be like a type A, and because that type of brain's always looking to be right, so everything's got to be right, everything's got to be moved right here, everything's, it's like everything's got to be perfect. So you're continually stimulating this, and or a type A is just, it's never enough. You always got to do more. You got to do more. You got to do more. You got to do more. All those keep stimulating this part of the brain, and so all of those things will create negative neuroplasticity. Even if you're a type A and you own 12 businesses and you've just built half of, like, you know, a big city and everything is wonderful, it's not, because usually this is being stimulated and you're in this fight-flight response. So what happens is this negative neuroplasticity causes this amygdala to continue that fight-flight response where all those hormones are being put out like 24 hours a day. Some like this, some like that, sometimes, but always being put out. High, low, medium. This person who can't go to sleep, they wake up, they can't fall asleep. There's a number of signs that this is going on. Your brain never shuts down. So this is negative neuroplasticity. And what's worse is the latest research shows that as that occurs, this amygdala, this fear center, actually grows. So basically, it's trying to either help you if you're the perfectionist or the type A, but it's trying to protect you from this egregious act of maybe being raped or beaten or shot or alcoholic parents or abandoned. So it's keeping you aware all the time. Okay, so that's the mechanism. But here's why I'm going through all of this. And here's why I said this is kind of foundational to getting better, but it's also something that creates problems. It certainly perpetuates problems, and here's why. These adrenal glands that are putting out, you can't see me down here, but these adrenal glands I'm pointing to on top of my kidney, these adrenal glands keep putting out stress hormones because the brain keeps telling them to keep this relaxation response shut down and keep putting out adrenals hormones. And so intermittently you keep putting out things that are altering your blood sugar, things that are causing stress hormones, things that are making you breathe heavy, those types of things. But more than that, there's one particular hormone that is extremely destructive, and it's cortisol. Most people who come here know cortisol as being bad. They've looked on the internet and cortisol is bad, 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 bad. But it's not until there's too much of it. Cortisol helps us to maintain our blood sugar. Cortisol works with certain chemicals in balance with our sex hormones. Cortisol, it helps to modulate our immune system in a good way until it's too much. And when is it too much? When you're in chronic fight-flight and you're putting out too much cortisol. And what does the cortisol do? I'm just going to give you kind of like the Cliff Notes part here, because this could be like, you know, a 20-hour lecture. But the core of it, what you need to understand is the stress hormone cortisol has a wonderful affinity to damage your frontal lobe. Here's the symptoms: depression, anxiety, panic attacks. Okay, so it's rare that you're going to have those without being in a chronic fight-flight response. Cortisol has been shown to create inflammation in the brain and be part of virtually every migraine that's ever been. There's a couple of parts to a migraine, but cortisol, the stress hormone, is a huge part of creating the chemistry that you're now starting to see online that they're ultimately making drugs for to take care of your migraines. It's the tightness in your neck, that headache that you're taking medicine for, you're going to the chiropractor for, or the massage therapist or the acupuncture physical therapist, and won't ever go away, that tightness in the neck and going all the way down into your shoulders and all the way down your back. The cerebellum causes that. Well, I thought we were talking about cortisol. Yeah, we are. The cerebellum is supposed to be shutting down the stress response, but when it's going like this all the time, cerebellum wears down, stiffness in the neck, dizziness, balance, blurred vision, all of those things come secondary from that mechanism. So it's a big, they actually are now thinking that it is one of the causes of the immune inflammation that attacks the thyroid, better known as Hashimoto's. The things that we see an awful lot: chronic sinus infections. You have a chronic sinus infection, you've gone to the doctor, you've gone to the allergy guy, you've had your deviated septum removed, you've had holes plugged up in there, and you still are getting chronic sinus problems. It's because we talk now about 70% of your immune system being on the inside of your intestines, okay? But it's actually in the inside of your intestines, on the inside of your lung cavity, on the inside of your throat, and on the inside of your nasal passage. And we step back a minute to where we talked about cortisol being part of what helps to modulate your immune system. So it goes to those areas to help alert the immune system to invaders coming in and calling out to white blood cells and things like this to get a lot of the immune system, neutrophils and everything, to come and attack until it becomes the problem. Cortisol in high doses is called catabolic. It's destructive. So those very tissues that it normally helps, it starts destroying. Now you start getting chronic sinus infections. Now you start getting food sensitivities because cortisol, remember, we go back now to the fight-flight response. The stress response does what? Shuts down your throat. So a lot of times if you're chronically stressed, you're one of the patients that can't swallow pills, that feels like you got a lump in your throat, that can't swallow, those types of things. Frequently that's the stress response overwhelming the cranial nerves here. But remember, when you're in fight-flight, it's shutting down the throat, it's shutting down the intestines and the bladder. So it shuts down the stomach and the intestines also, okay? It shuts down the stomach and the intestines, it shuts down the lungs. This is the number one cause of chronic non-pathological asthma, athletic asthma, is chronic stress hormones or immune inflammation. But chronic stress hormones play a big part in these chronic asthma cases. But the gut is like the huge thing. Most people understand that stress causes ulcers. People have known that my whole lifetime, okay? So, but now we know why. We now know it kills hydrochloric acid in the stomach, and then you can't digest your proteins, and now the protein sits there and it becomes acidic. And now what do? You go to the doctor, they say, I got acid indigestion, and they give you an antacid, a omeprazole, and they tell you to take this, which now kills what little hydrochloric acid you have left and kind of duplicates the physiological effect on your stomach and your intestines that's already being caused by the stress response. This is bad because now you're not making hydrochloric acid, you're not digesting your proteins, that becomes acidic. This is the number one cause of gallbladders not working because there's a signal sent from the stomach to the gallbladder to say, hey, don't work. There's a signal sent to that was called cholecystokinin, that's a hormone. There's another signal that's sent to the pancreas that said, don't work, because the pancreas and the gallbladder all empty into the same area that the food empties into, which is the duodenum right below your stomach. And so your body's wired to make sure that those try to not get infected or inflamed. But once you have this stress response, that's shutting down the ability to make hydrochloric acid in your stomach, then it starts doing that. Now, long term, that stress response kills those parietal cells that are making the gastrin and the hydrochloric acid, which are the chemical things for the chemical nerdy guys out there. And once that happens, and it keeps happening, that's when you get an ulcer. Okay, and then you get an ulcer, and then what happens? You can't kill bacteria, you get H. pylori. You can't kill bacteria, you get small intestinal bacterial overgrowth, because these bacteria either sit in your stomach or make their way into your intestines. These stress hormones have an affinity for the inside of your intestines because cortisol is part of the immune system. 70% of your immune system is on the inside of your intestines. It's called secretory IgA. That starts getting damaged. It starts flaring up, and the next thing you know, you start getting leaky gut from that. You start getting food sensitivities while you're in fight flight. Your intestines are shut down, so it's not only so in the long term, it's creating inflammation in there, which creates all this other type of symptoms. But it also decreases blood supply to your intestines. It also overwhelms this stress response. Okay, I can't see how high I need to hold this, but this stress response, okay, that's going from here, is shutting down your parasympathetic nervous system. Well, your vagus nerve, which it comes from right here, is what controls your bowel movements. This is the number one cause of constipation, by far. There are other causes, don't get me wrong, but this is the number one cause. Oh, what else is here? The mechanisms to filter out pain is here. So if you have a central pain syndrome like fibromyalgia, or some of these other central pain syndromes like reflex sympathetic dystrophy, it's partially or largely because your stress response is overwhelming this area. This is a big part of those things. And so this is like, they're now calling irritable bowel syndrome, constipation or diarrhea 3 days a month for more than 3 months. They're now calling that irritable brain syndrome. And the last thing I see a lot here, particularly in women, Two last things. I just did a talk just a few minutes ago before we started this on infertility. Okay, this is a huge part of causing infertility, polycystic ovarian syndrome, those types of things. And it's also the number one cause of chronic cystitis, pain in your bladder. Because again, when you're in short-term fight-flight, your bladder is like your bladder is shut down. Okay, but when you're in long-term fight-flight, I mean, when you have constipation, at some point, you know, your small intestines are having to empty into your large intestines, and at some point, even though your brain's telling it to shut down, you know, your bowel, you have a separate nervous system in there is going, I gotta go, I'm full. It's the same thing with the bladder. The bladder fills up, it's confused, the brain's telling it, I'm in chronic fight-flight, don't pee, but there are reflexes inside of the bladder going, I gotta pee, and because I'm getting full up, then you start getting pain. Next thing you know, you urinate, okay? For those of you who like urination better than pee, you urinate, and then the next thing you know, because there's an abnormality in the way this functions, you get urine in your urinary tract, and this is the number one cause of chronic urinary tract infections. So what happens to those? You go to the doctor, they give you antibiotics, right? And what does it do? It screws up the stomach that's already being screwed up by the same mechanism that's causing you chronic urinary tract infections. And I go on with this for like ages. Oh my God, there's like so many. It literally affects or can affect literally every single cell in your body. So when somebody comes in with a chronic condition and they've been through everything, and they're taking and they're taking medications for their depression or for their panic attacks or for their anxiety, and they're taking medications for their gut, and they've changed their diet, and they're doing all of these things. They really haven't addressed the chronic fight-flight response. That person's never going to get better. They might get better for short periods of time. They might have certain things get better. Maybe maybe you find out you have small intestinal bacterial overgrowth, which we're probably going to talk about in the next presentation. And then you get on the FODMAP diet, and then you take let's say berberine is one of probably a dozen things you can use to get rid of those bacteria, and they go away for a week or two. So you're starving it, you're killing it. They go away for a week or two, or maybe even 6 weeks, and then it comes back. Why? Because the perpetuating factor is the stress response that's killing the hydrochloric acid in the stomach. That's not allowing you to have the hydrochloric acid. That should be killing any new bacteria that's creating that. And that has to be taken care of. And it's the biggest challenge. Honestly, the biggest challenge is to get that brain under control. We use a variety of complementary approaches, but it's a little different for each person. And sometimes when that person is in chronic fight-flight, I mean, if they get up to like a 7, maybe 8, definitely a 9 or a 10, you may have to go to the lengths of counseling. We've sent people to trauma counselors. We have a clinical hypnotherapist that we work with. There are functional psychiatrists. I'm here in Reno, Nevada, so these people are here in Reno, Nevada, that we work with. Because sometimes even brain rehab exercises and self-guided meditations and tapping exercises and herbs and botanicals and nutraceuticals and neurotransmitters aren't enough for when that brain gets so, what we call it sympathetic wind-up. When you get sympathetic wind-up, I mean, you just came back from the war in Afghanistan or something like that, and you've had one of those experiences, you've been in the middle of combat, then that has to be done. If I have a patient that comes in and they're in that situation, or if I have a patient that comes in, and I've had one or two in the past couple of weeks who are in the middle of a massive trauma, like you're in the middle of a divorce, and it's just divisive, and you're going to court. And who knows, I even had one where they couldn't afford to live apart, so they were still living in the same house. You're not getting a person better when that type of trauma is there day in and day out. Those people, I will advise, no matter how sick they are, that they need to get through that first. Then they can come in and then we can start working on them, and then we'll get a response. Because trying to overcome that, it's like having this massive fire and trying to put it out with like a garden hose. So these are like the perspectives I'm trying to give you relative to the stress response, because I even have people come in here and say they're not stressed. How do you know you're stressed? How do you know if you're in this response? One of the things I talked about was this I can't go to sleep, I wake up, I can't go back to sleep. That's largely a stress response and a blood sugar response, and that cortisol also screws up your blood sugar as well as causes all those stress responses. Another thing is if you find yourself, if you close your eyes just gently and you find your eyes fluttering like that, that's called blepharoplutter. Blepharo means eyelid, okay, like that. That'll show you. If you have clamminess on your palms and clamminess on your feet, and that's just me, no, it's not just you. You're in a fight-flight syndrome. If you're one of those people who are sitting there and rattling your leg all the time or doing something like that, that is an instinctive response of your nervous system to move some body part that will send stimulation back to your cerebellum. If we go all the way back to about 20 minutes ago, and I said the cerebellum is what is supposed to shut down the stress response, then that's an indicator that you're in that fight-flight response. Because that leg movement or those things that you try to do, some people have other mechanisms to do, that feeds back to your cerebellum and temporarily strengthens it. This is why exercise, this is two reasons why exercise helps to calm down stress, is it dampens that, it strengthens that cerebellum and dampens that stress response. It also helps to control your blood sugar, which I'm not going to get into all the chemistry of how that brings down your stress response, but it does too. So I think that's kind of like as much as you need to know about stress at this point in time. And I go back to saying that I believe that this is me, okay, this is me, but I believe that they're going to come out one day and say, this is the cause of the chronic situation that's going on out there. And at first, I thought it was autoimmunity. My mentor, Dr. Datis Karazian, was the gentleman who first developed the understanding of something called Hashimoto's thyroiditis. That's an immune attack against the thyroid. That was long before anybody had even heard of that. Everybody just thought everybody had hypothyroids, and so we found out that the vast majority of it was immune attacks. Now everybody's got immune attacks, right? Back at that time, nobody had it. It was just MS, and it was a couple of things. But I think it's the stress response that's breaking down the gut and the immune system inside of the sinuses, the lungs, but particularly the gut. I think that's panning out into the rest of the system. And I think that is what's causing this autoimmune explosion. It's a much, much more stressful situation in society than when I was younger, and I'm in my late 60s. So it wasn't perfect, but it was a lot less stressful. And we didn't have the stimulation, the constant stimulation to our brain. Things seemed to be more stable back then in just so many ways. And as I see this over the years, we're not getting less people who have autoimmunity. We're not getting less people who have chronic, but we're getting more and more and more and more. And so at the very least, this is a core of people getting sick, but as you can tell, this also perpetuates the things that I believe that it might create in the first place. Now it's off to the races. Now it's parasites, now it's yeast, now it's candida, now it's small intestinal bacteria overgrowth and IBS and blah, blah, blah. Anyway, that's the way we see it. It's been a pretty successful approach for us to treat that at the same time we're treating other things. That's stress. So you can see why I say it's kind of like straddles the, is that a foundational thing or is that a treatment type of a thing? Again, we have two pages that summarize virtually the rest of the person's entire physiology, and we have 5 pages on brain function and stress. So I mean, that kind of represents how we see it, and I think it's just important for you to know that. So I think that's enough. I think that kind of covers it. I think that should light you up and really give you kind of like where it's at relative to you, give you an opportunity to think whether that's happening or not with you. So that's stress. Next time we're going to get into the actual physiology, kind of in order. Again, this is back to basics. This is functional medicine back to basics. Some people would argue that what I just went over is not functional medicine. My mentor just just went through Dr. Krasnian just did a 3-day course on neuroinflammation and how it affects everything. And basically, 90% of what I just told you is that course. So it is within the realm of functional medicine. And so we're going to get it. Now we're going to get into the breakdown and kind of the order. There's not an exact order of breakdown into how to attack this, but there is a general order of how to go about this. And we're going to start on that the next time that we meet. And that'll be back to basics on functional medicine. Keep it simple, as my producer said. And that'll be the start of the treatment portion of this series. So I hope you're enjoying this. I like doing it. I like feedback. Please feel free to comment on this. Let me know if I'm going in the right direction. Let me know if this is something you're interested in. You have any questions, feel free to send them. I'm not the best email guy in the world, so I'm not going to get back to you in 24 hours, but I will get back to you. And so until next time, Dr. Martin Rutherford, Certified Functional Medicine Practitioner of Power Health, signing off. Bye.